if you have your clients who are saying good things about you. For the past 5 years, Care to Stay Home has consistently ranked the top home care company in America to work for by Fortune magazine. And Parker, we saw testimonials from several of your employees who brag about their experience and how much they love working for you. And also, we know that the focus of Care to Stay Home is to enable your clients to remain independent at home while receiving support from your professional services. You offer so many services such as companionship, which we've talked about with my mom, includes home organization, assistance, medical reminders, plus some light housekeeping, taking people for a walk, and then some things such as picking up their prescriptions. And for clients who need more home hands-on care, you can assist with some other things like grooming and helping them dress and so forth. We know all of that. So we know how important it is to have home care and how important it is to have the right company and the right people in the home. I know for us, I worried, like, if we had someone else in the home, what would we do? You know, I could never go to sleep knowing someone else was in the home with my mom, that I wasn't watching them, which brings me to something else that I read about you, that for the last several years, you've partnered with Connect America West, which is a medical alert system company. So we want you to tell us about that and what that means. And also some of these other things is how you meet people and how you take care of them and how you decide who's the best caretaker for your patients. So we've talked a little bit already, Parker, about your journey into the world of in-home caregiving, and it's quite unique. What are the personal experiences that led you to this career?
Yeah, thank you so much, Valerie, for having me. I'm excited to be here and share a little bit of my story and about what we do. My journey into the healthcare experience or space is a little more unique. My father was actually the hospital administrator of the hospital I was born at. And so he was working in his office one day and he ran down to the labor and delivery unit, watched my birth, and then he ran back to work. And back in those days, we didn't have the 3 months of family medical leave and all these things.
We didn't.
So it was a unique experience from my upbringing. And my father was always in the healthcare administration side of the fence, where he was working in health insurance companies and even worked up to here in Orange County, kind of run and manage Cal Optima for a number of years. And he was involved in a lot of the contracting work around the development of their at-home care networks with home health providers and hospice providers. And seeing the need kind of culminate, he decided to purchase a small in-home care business. And that happened to coincide at the same time when my grandmother became ill and needed a caregiver. And so we were very intimately aware of family needs. And I was very close to my grandmother growing up. We had a wonderful relationship where I learned from her and I saw people coming in to care for her. And I appreciated what they were providing on a professional level, but also recognized the importance of their work, both personally to our family, so that we could come in and not be the caregivers. We could come into the home and be the grandchildren and the children. And so working through that experience of both through my father having home caregiver services and being very connected into the industry, and also watching this on a personal level with my own family, I knew that I wanted to go into a field where I could serve other people. And through college, I had some unique experiences that pushed me in the way of public health. And I absolutely appreciated the guidance and direction I received early on in my career to step away from hospital administration into this long-term care space. And so for me, it's been a blessing to be able to share my talents in home care and to be able to do what we do today.
Well, certainly, yeah, we all have the stories of, and I hear it every day, Parker, from my colleagues and my friends, and that we all have a story, and our story begins with, I had a grandma, or I had a grandpa, or I had a dad or a mom. And when I saw what happened with that experience was when I was inspired to get into this field. So because I saw the need and I had a heart to serve. And I see that all the time. Let's just get right into this. There are so many myths about in-home care, and I'm sure you've heard them all and more than I have. So can you share some of the most common myths, most common misconceptions, and how they impact family decisions?
That's a great question. I think first and foremost, people are often afraid of the cost, right? This is so expensive. And while in-home care can be expensive at certain ends of the spectrum, it's also probably the most flexible and adaptable service that can be scaled to meet your needs. Not everybody requires around-the-clock 24-hour care. And so it's one of the services, or one of the only services, that you can provide in your own home that you can almost custom tailor to meet your specific situation and therefore also meet your specific budget. So cost is one thing. Another thing I hear a lot about is caregivers, their trust and dependability, and whether or not they care about their clients. And I would say that the vast majority of caregivers who are out there do this work not for the compensation or the accolades they're going to receive, but more so because they care. And they've found themselves either wanting to or desiring to help other people. And so our caregivers that we come across are incredibly patient and loving. And I think that's one thing that people don't always connect with or understand when they first start care. Same thing they think about, families often think that once they get assigned a caregiver, that they have to keep that person forever. And that probably couldn't be further from the truth. Actually, you don't have to keep somebody forever. If you love them and you want them, you can certainly retain them as long as it's working for both parties. But also, there's a lot of people that are out there. Not every personality kind of fits or blends with your lifestyle or who you are. But I would also say, on that same token here, Valerie, that sometimes families feel like the caregivers are going to take their place and become like the family or like children. And from what I've seen in my experience, it's more often that the caregivers enhance a child's ability to come in and be a daughter, as opposed to having to coming in and worrying about all the things that haven't been done yet. Has mom been taking her medications, or when's her next doctor's appointment, or all the other things that distract you from just spending quality time with your parents. And so I think a lot of these misconceptions are just born out of stories that people are hearing, or, accounts of secondhand or thirdhand shared experiences. But in reality, building your own care team, having your own plan for your parents is so important, and exploring a lot of different options to find the right one that's going to meet your needs is important.
And certainly all those are myths. And as far as the caretaker, one of the myths is, and we've experienced this, there isn't anything we're going to talk about today that probably, we haven't been through. So I can really relate to them sometimes more than I want to. And I just have to interject here. I think that there is a special place in heaven for people who have or who are currently caregivers. That
Agreed.
is, there's just
Agreed.
got to be, I'm just sure. So it keeps me going some days. But some people wonder, so why should I hire a caregiver? Why don't I just find somebody, a friend of a friend? She'll be a nice lady, and she's a very nice lady, and, she'll be nice to your mom and, whatever. So why not just hire somebody? Why use do you call yourself an agency?
Yeah, great. That's a great question. I think a lot of families do try to explore the option of having some help at home through informal caregivers. And while there can be a time or place for a neighbor or family friend or someone from church to come by and help out, formally trained caregivers through a licensed agency really provide a lot more accountability and a lot more oversight in this entire process. And there's a big difference between having a trained professional in the home and an unlicensed, untrained professional. And we can speak about kind of the risks of both, but also talk about the benefits and where one might be applicable and another may not. And certainly, I think, finding a friend or word of mouth caregiver who you bring into your home it sounds appealing because there may be a connection to the person, there may be a lower cost, but there's also certainly a good amount of risk that you are bringing on when you decide to bring somebody and pay them to be a companion or caregiver in your home. And oftentimes, families don't recognize the risks that are associated with bringing in an informal or unlicensed provider to the home.
So, are there some horror stories that you could share without getting too gory that
Yeah,
would bring this to mind?
yeah, and unfortunately, they're becoming more and more common just as more and more people need care. And we've encountered several families who have tried this route and hired somebody informally, and they oftentimes end up coming to an agency because they've had a bad experience. The state of California has really started to crack down on enforcement of what we call independent contract workers.
Mhm.
Really, caregivers are not client. I'm not an attorney, but not going to provide legal advice. But certainly, in my experience and what I've seen and what I know, caregivers are not often categorized as an independent contractor, meaning their work falls under certain statutes and guidelines that need to be paid for accordingly. And so there's wage and hour laws, and we've seen unfortunately families get sued by their employer caregiver, by their employee, for not following overtime and proper documentation of hours worked. We've seen unemployment claims come up, and the state wants to know who the employer of record was, and it's a private family. And so the state comes asking for back taxes and wages. And probably the worst is when you have a household employee, a domestic employee, and they get injured on the job. This work is oftentimes heavy duty, back breaking work. And I've literally had employees who have broken their backs while at work because they're trying to transfer a patient. And I've seen cases where families have hired a private caregiver who did get injured and then came back to collect on their workers' comp when there was no workers' comp coverage in place.
Right.
And
Yeah.
so that risk falls then to the family to pay for these medical bills and expenses at times. So it's a
And how
very
sad.
big unknown.
Yeah, and how sad to be in a situation where you're having to deal with someone you love and you're trying to do well for them, and then someone comes back on you and and kind of um, you know twist the knife, so to speak, makes it worse. And so I can appreciate that.
Sure.
You have a story that you talked about? I heard you talk about when you were leaving on a family trip, and that may not be the only one. I'm sure it isn't, but can you tell us about a moment or a time when someone really touched your heart and it was a situation that you were just so glad you were there, and it was one of those times that you thought, what would this family have done without me, or what would I have, it's really is something, this is what I was made for, kind of a story.
Yeah, absolutely. I think there's several, I mean, dozens of families that have really touched my heart in a lot of ways where I feel connected to people beyond just a friendship or relationship. One family in particular, we were contacted by a local nursing home. The wife was needing 24-hour care, extremely non-compliant, lived in a trailer park in Santa Ana,
Oh,
and it was a really tough situation. And we got called in to help bring this patient home. And her goal was to be at home with her husband. They had no children. They had really, limited access to anything outside their home. And we deployed our team. We set up caregivers there at the home. And really, within a matter of probably a month, we started to see a softening of this really hardened woman into somebody who was a little more accepting of care and help, recognizing the dedication that our team had really gone through to help her get to where she was back at home and happy. And we cared for her for a number of years, and she finally passed. And
really?
then we
Yeah.
cared for her
Oh,
husband for a number of years. And it wasn't until he passed away that we sat down with the brother, and I still keep in touch with him to this day. 10 years after this gentleman had passed, he actually just texted me probably a month ago. And one of the things that stood out to me the most, Valerie, was the gratitude that these care providers provided to his brother who had no children. They became like his children, they became like family. And he was so grateful for how much they loved him and appreciated him. And he shared some very personal stories about how difficult his brother's life was. But for me to know that we were there in someone's moment of need, and there's a lot that I could share about their air conditioning unit that broke, and I needed to go out on a hot summer day to crawl underneath this trailer to kind of figure out what was going on. And so much time and energy was poured into this, but it's really a labor of love, and we do it because no one else was there to. And to me, Valerie, that is what connects and unites us together, is what we do for other people, regardless of where we come from or who we are or our status in life. We're there to serve one another. And I learned a lot
Absolutely.
from this experience.
Well, we know, and you certainly can attest to the fact that choosing the right caretaker is so personal. It's very personal. And because you don't know where the patient's coming from, what their past experiences are. And some of them want to be cared for more than others, and some of them don't want any help at all, but they need it. So how do you ensure, Parker, that your caregivers connect on a deeper level with the families that they serve, and that they really become a good match?
Yeah, I think communication up front is key. Knowing personalities, knowing likes and dislikes. We really try to understand why the client wants a caregiver or needs a caregiver. And we spend a lot of time up front trying to identify and diagnose that, because every family and every situation is different. Whether you're coming out of a hospital after surgery, or whether you're just getting older and might need a companion or somebody to help around the house, every situation is 100% unique. We do spend a lot of time up front trying to communicate and understand the motivations for having care in the home. And then once we kind of build out a profile, really, we do a lot of communication back and forth with our caregivers, with our family members, with the client themselves, and other people that might be involved in what we call that circle of care. It could be another member of their interdisciplinary care team, like a doctor or home health nurse. And so we want to get feedback on how care is being received. And we do this in a lot of ways. First and foremost, I think visiting the patient in the home, seeing the home environment, understanding what they want, what are the client's desires. And then when we go back to match a caregiver with the client, there are so many variables that come into play. If you think about it, I've encountered situations where somebody's allergic to cats and dogs, and yet mom has or dad has a cat in the house, and that won't work. And distance and location and skill set. This patient's got Alzheimer's, and you need to find somebody who's able to work with that condition, or the patient's got dementia, and Parkinson's. And so what does that do to the body? And how do we find somebody who we know has some Parkinson's experience, but then we can train that person up to work specifically with this Parkinson's patient, because Parkinson's may present differently or at different stages. And so that's one of the best ways is, again, gathering that information up front and then being able to prepare our staff. But then once care has been initiated, it's really soliciting feedback and listening to what's being said, but also understanding what's not being said. And a lot of times our seniors have preferences, and we want to be mindful of those preferences because we're coming into your home. We're coming into your environment. And we want to make sure you are 100% comfortable with any care professional coming into the home. And that's another difference there, Valerie, between an agency versus a direct hire or private hire. Sometimes that private hire, you kind of have to make do with what you got, and what you got is what you got. And an agency, on the other hand, if you don't like this first person, let's go back to the drawing board. Tell me why you didn't like them. What could we change? Is it something we can train the caregiver on and improve? Or is it just that personality doesn't fit quite right? And let's go back and find somebody a little bit more mild or quiet. We've had everything in between where, this caregiver talks too much, or this caregiver doesn't talk enough. And so it's important to get the right fit.
Absolutely. So when someone first comes to you, what are the things that you do? What are the steps that you take when you hear from someone?
So first we identify who's talking. right? Is this the patient themselves talking to us? Is it their daughter? Is it the social worker? Is it a hospice case manager? Who's communicating the information to us? And the second thing would be setting up a meeting with the family or those involved. We love as much information again at the start as we can. And that initial assessment usually lasts about an hour. And we ask a lot of questions going into your medical history, into your setup at home. And ideally, we like to come into the home and see what the situation looks like. There's sometimes a lot of really simple, easy modifications that we can make at home that make it safer and easier to maintain your loved one there. So that initial assessment gives us a really good foundation for what care should look like, and we formulate a plan of care. After that, we usually share that plan of care with the family and ask for any input, anything that we might have missed, see if we didn't gather the right facts. Once we've kind of finalized that, usually within about 24 to 48 hours, we can get care started with a family. When we get care started, though, we like to have a representative from the company come out and introduce the caregiver. Typically, it would be the same individual who met with the family upon the initial assessment, just to ease a transition into having a caregiver and making that introduction so everyone's comfortable. Usually within the first, week of care, one of our care managers who's working with the family will reach out and kind of get some feedback on how things are going, and then probably set up another visit to the home to talk with the patient and family member about the first week or so to gather more information. And with that, we'll ask questions about what do they like, what things went well, what things didn't go so well, how do we improve upon those things. And again, if there are tweaks we can make in that plan of care, we're going to start making them. So it's really, I think the biggest word I can say here and how to do this efficiently and effectively is communication. We have to be able to communicate. And our job as an agency is to communicate with the children, the patient, their care providers, the caregivers, and everybody to know what's happening with this patient and what's the end goal. What are we trying to accomplish?
Certainly, dealing with the whole family is a challenge because you have what we call the adult children of aging parents, and of which I am. But some of them are living in another part of the country, so there must be challenges. And I know if I was having to pick someone in a different state, my parents were in a different state, that would be very hard to get a comfort level. So I'm certain that dealing with the whole family is always a challenge.
It can be, but more often than not, there are one or two individuals who have been assigned a role. And most people today are familiar with the advanced healthcare directives. And they've assigned a son or daughter or even a third party to oversee either their medical decision making or their financial decision making. And as an agency, we like to try and identify one or two people that are going to be the primary points of contact with regard to in-home care. And that's really important to have an established line of communication. So if there are changes in condition, if there are certain situations that come up, we know exactly who to contact and where to reach these individuals. Sometimes it is the son or daughter that's closest by, but sometimes it may not be. We've had situations where, the patient has an adult child living in the home still, and that person may not be the right person to contact in the event of some change or coordination in mom or dad's care. So we really do our kind of due diligence on making sure we have a really clear line of communication. And so therefore our caregivers and our care managers and everybody in the organization knows who our primary points of contact are in the event of an emergency.
Well, let's talk about one topic that most of us would rather not talk about, and that's the finances. So how do people pay for this? And is it can you get Medicare or any of those any other that assistance or VA assistance, or what are some of the ways that people can pay for this?
Great questions. I would say the majority of patients pay for long-term in-home care, again, non-medical, we haven't talked about home health or hospice yet, but the non-medical side is paid for privately out of pocket. Most oftentimes patients or clients who have accumulated wealth or assets can leverage those assets to pay for their care later in life. Some patients have taken out a long-term care insurance policy. That long-term care insurance policy is kind of like a life insurance policy where they paid a premium every year for this, and there's going to be a payment back when a claim starts. And we absolutely go to great lengths to make sure our clients and patients get their long-term care insurance benefits. So if you have a policy, or if your parents have a policy, crack it open, whip it out. If you don't know what that language means, by all means, we'd be happy to review that with you, for you, and provide you our opinions on how to use that policy for your benefit today or even down the road. Beyond private pay, cash, or long-term care insurance, there's also some Medicare Advantage plans that do offer some caregiving components or benefits. Here in Southern California, there's a Medicare Advantage plan called SCAN that does have some caregiving benefits associated with some of their plans. But there's also more talk about Medicare Advantage plans offering non-clinical or non-medical services to their patients. And this whole hospital at home program has been more successful as Medicare sought to expand what types of services they will cover. As at the moment, Medicare itself does not cover non-medical home care. But there are also, as you mentioned, some Veterans Administration benefits. There's some pension benefits like the aid and attendance benefit that actually does help to compensate spouses or surviving spouses or veterans or their spouses with a monthly pension to pay for in-home care. And we've absolutely helped dozens of patients file for those benefits and receive them. And that's something that there's a great need for as well. Beyond the VA, there are also programs through your different states, like in-home supportive services that do pay for caregivers to come out and provide some basic services. So at all levels, there is something that could be had or some program that might be appropriate for patients who need in-home care.
And there are benefits available sometimes, I realize, and under some circumstances, for a surviving spouse of a veteran.
There are.
That's interesting. Yeah, that's good to know. And then that's something you help with? Otherwise, people just go directly to VA?
Yeah, they can file an application through the VA. There's a couple of groups out there that also help veterans to qualify for these benefits. But more often than not, the main qualification is if you're receiving care currently and that expense is added to your monthly, total expense compared to what your monthly income is, there are certain requirements you'd meet to qualify. And upon meeting those requirements, the VA can approve payment back to that veteran or their spouse. It does take some time for those applications to be reviewed and approved. But from my experience, I've seen the Veterans Administration pay retroactive to the date the application's been submitted. And so if you are having a family member or know of somebody who was there's some time frames when you can look them up online. And through the VA, you can call your local VA office and ask them about the aid and attendance benefit. And they should be able to provide you with all the forms and all the necessary documentation you might need to kind of accumulate to submit an application for that pension.
So when someone comes to you, do they already need to have all that in place? Or is it something they can contact you and you'll advise them? Or are they supposed to go out and find it on their own? So a lot of times people who are in this situation, when they need you, they haven't started that process yet. Certainly we didn't.
Correct.
We were doing that.
Yeah, a lot of people don't know that, and they don't know what they don't know. And so they come to us and we start asking questions like, is your loved one a veteran? And did they serve in a wartime era? And if the answers are yes, then we want to absolutely talk about this aid and attendance program and help them file for these benefits. Or another screening question we have on the assessment when we intake a patient is, do you have long-term care insurance? And I can tell you, even if we start care today, and in 6 months you find out, oh, you know what, my parents do have an insurance plan through John Hancock or whatever. We can go back to John Hancock and say, here's the documentation of when care was initiated, why it was initiated, and support the information to file an appropriate claim. And so a lot of times patients are not familiar with all of these avenues, and that's why having a trusted, organization who can help walk you through these programs is really helpful.
Well, let's talk about that. So yes, having a larger corporation is important, but then sometimes I think there's a difference. And of course, I always think that because I'm a small company and think I provide a lot of personal service, and I know you do too. So what about when do you get to that level where it's a company that's so big that they don't have real personal service and a company that's your size? What are the differences?
Yeah, that's a great question. And I think that's one of the reasons why in our home care space, it's a little more fragmented. It's a difficult industry to be in because it's 24/7. There are people that need care all the time, and there are people that are working for you all the time, and it can be very taxing. We are a licensed agency, and I think the bigger you get, the harder it is to maintain some of the control of your processes internally to keep the patient and the care provider at the center of everything that you do. Our goal as we've grown has been to always keep the caregiver and the patient at the center of all of our decisions. And that has really served us well. I think going back, though, to the licensed agency model and having a licensed agency, it allows for families to have some level of security that the care provider has been thoroughly vetted or trained or background checked and screened, and there's not any risk of, any kind of communicable disease. We provide some really core benefits that keep our seniors safe, right? Not dispatching an employee who might be sick and risking getting an elderly patient sick. And some of those practices, as you scale, sometimes become more difficult to enforce. And so I think that's one of the things that really keeps Care to Stay Home grounded and based is our policies, and not willing to compromise on any of those policies, and making sure that we carry those through. Another thing I'll mention here too, Valerie, just here in locally in Orange County, California, when licensing happened, this was in 2016, and there's about 250 home care companies in Orange County alone today that are licensed, but only about 50
Not
of those
individual, but actual companies.
250 companies that are licensed home care organizations in Orange County alone. But in 2016, when this home care bill came out and every home care agency needed to be licensed, there's only about 60 companies that are still in business from 2016, which means that the other 200 or 190 companies have been created since basically 2017. And if I were to go back to look at the pandemic, about 90 of those companies have started during the pandemic. And that's one other thing that I'll mention is there's a lot of agencies that are out there, but finding professionals that are experienced, that you can trust, that have a history of providing care is super, super important. I was on a call this morning and just with 4 or 5 other employees of mine, and I started to ask them, how long have you been in home care? One was 21 years, one was 25 years. We just on this call, we had over 100 years of combined experience in talking about home care, and finding those experienced care professionals and care managers and recruiters that know what to look for really helps you to have solid processes so you're not compromising on patient care, or you're not cutting corners when it comes to how to comply with state regulations, but also make sure that patient is getting the care that they want and that they need.
Absolutely. Experience matters. You just can't downplay the importance of experience, because something always happens, and certainly in our occupation, in your occupation, something always happens. And somebody who's been through it or had some similar situation can react quicker and better and more efficiently and more caring than someone who's like, now what do I do?
100%. And I think that we see this constantly in all types of industries. I mean, especially in real estate, where one of the largest things you're going to do is buy a home, and you want to have trusted guidance in that process. It's paramount that you have somebody who's been through this before, that can walk, and somebody that you trust. I think that's really a core tenet of having guidance, is getting guidance from people that you trust. And building that relationship of trust, oftentimes it does take some time and it takes some effort. And so when you're looking for in-home care, or if you're inquiring about it or not sure where to start, talk with your family, talk with friends, talk with neighbors, talk with other people that have been in this situation. But then also pick up the phone and call. I think you'll find that you can gather a lot of really good information by making a few phone calls and kind of starting to make a list of the questions that you think you want to ask, and ask. I think a lot of times families wait until that crisis happens that we talked about.
Sure,
they wait until the shoe drops and mom's in the hospital and it's going home tomorrow and we need a caregiver. The people who do that homework ahead of time and they plan for it, and we do that when we buy a house. And next year, I want to be able to buy a house. So today I got to start putting in place the things that will help me to get to that goal. Well, talk to a real estate agent and figure out what are those things that I should have in place. And I think the more we become prepared into that context, the easier it is as we walk through that experience. So being prepared for when that shoe drops or when you're going to purchase your next home, and working with professionals through that process is very important.
But people don't want to talk about this. They don't want to think they're going to need it. Parker, every guest I've had on my show, when asking what advice do you give to someone who might need your services or whatever it is, if this is going to happen to your family, every one of them says, plan ahead. Plan ahead. Think about it ahead of time, right? Talk to your parents, talk to your brothers and sisters, plan ahead. One of our guests, as a parent who has Alzheimer's, what could you do in that case? He said, when you see the signs, do something about it. Don't brush it under the rug and think it isn't happening. And so certainly planning is something that, people don't want to talk about, but it certainly seems to be a pretty important factor. As we say, make informed decisions rather than crisis-based decisions. And I know in our case, we got a call from the hospital and said, we're discharging your dad. And I said, what are you going to do with it? What do you mean he always stays in the hospital? Well, we can't do that anymore. So what are we going to do? We had nowhere to go, no place to put him, no idea, and certainly no information. My dad was 99. We had no reason to believe he was ever going to die. So, and just not planning ahead always seems to be the big problem. Let's switch here a little bit and talk about something that we should learn more about, and I'm sure that you see it. Two things. First of all is networking. Do you network with other industry professionals around the country? And second of all, let's talk about technology. What kind of things do you see coming up with technology in the home care industry?
Yeah. So first on the networking side, absolutely. I think there's a lot of trends happening nationwide that kind of find their way down into the local arenas. So I work with companies in the West Coast, East Coast, served on some boards of different businesses, and very familiar with a lot of things that are happening in different parts of the country that find their way into kind of the mainstream care arena, whether that's changes in Medicare and Medicaid guidelines or things that the state's doing at a state level. So staying connected is very important for us to be on the front edge of what's coming down and how can care be shifted or changed or modified at home. And that leads into technology. I mean, there's a lot of things that are coming out today to help ease the burden of caring for a loved one remotely, whether that's, sensors and cameras in the home down to what we mentioned at the top of the show, a medical alert system. And one of the things we found, Valerie, is that sometimes patients don't want a caregiver in the home. They don't feel like they need it. And so they hire us as little as possible to be there as kind of a safety stopgap. Oftentimes it's the adult children who are saying, Mom, we want you to have somebody. And mom says, nope, I don't need it. And so we find ourselves in this kind of juxtaposed, we're there, but we're not there. And we really want to care for that patient all the time. And we want to have an eyes and ears on the patient all the time. And oftentimes there's a balance we have to strike between safety and autonomy. We want to give mom her space and individuality and recognition of her own autonomy, but we have to balance that with how do we keep mom safe. So we offer a medical alert device that we place in the home. We pay for it because sometimes that's the barrier. Mom doesn't want to spend the $20 or $30 a month to have the subscription. That's fine. Let's take away that barrier. We'll care to stay home. We'll cover that cost just to give all of us peace of mind to know that, yeah, mom might have a caregiver for 4 hours a day, but the other 20 hours, she's all alone. And we want to stay connected. And we've had patients push that button in the middle of the night. We get a report. Our families get the report, what happened, an incident report goes out. And then we can start diagnosing and treating that condition. Maybe it is a little bit of help at night. Maybe we do have a caregiver who comes in and does a little tuck-in service at the end of the day. And we can notice patterns or trends, and we can help to improve care through the delivery of this little medical alert device that gives us a window into what's happening the other 20 hours we're not in the home. So that's just one component of beyond cameras, sensors, and developing patterns of behavior. You know, maybe my mom gets up every morning between 7 and 9 a.m., but today the sensor didn't go off. Is she in bed or is she on the couch? And so there's a lot of this, I'll say, technology that's going to be married with some of the AI components. And we're already seeing wearable devices that will monitor blood pressure, heart rate, pulse ox, and that will be data driven back to physicians to make better informed decisions on how to care for their patients as well.
And you mentioned something that's a hot topic, but all of us don't know a lot about yet, is AI and how it will impact your industry. Can you tell us something in the next 30 seconds or so about how AI will be a part of your industry?
Yeah, I think the ability to plan and prepare for and to create custom care plans might be further developed through the use of AI. I also see the ability to customize a treatment plan with various conditions. You know, an 85-year-old patient who's got dementia, Parkinson's, and some other, cardiac condition. How will we treat those things and be able to provide better data to care providers so that they're aware of, medication information and also, diet and exercise information to help best help that patient.
Let's talk about something else you mentioned was hospice. Where does your care start and where does it stop? Is that a good question?
That's a great question, and oftentimes so confusing. Medicare will pay for home health care, and that is a nurse, therapist, or licensed healthcare professional to come to the home and provide you with restorative services to help you get better. Medicare will also pay for hospice services, which is what we call end-of-life care. And that is a medical professional to be there to help manage your medical needs at home during your last final phases of life. Home care can span all of those things. Even before home health is involved, home care can be there. Even before hospice is involved, home care can be there. Even when hospice is involved, home care can be there. And so we don't really have a starting or we'll call it a stopping point. As I mentioned in one of the stories I shared, we cared for a wife for a number of years. And then when she passed away, we continued on with the same care team caring for that husband. And so there can be a continuation there even after hospice services are no longer needed because the surviving spouse might need support or bereavement or whatever. But we don't take the place of hospice either. We don't take the place of home health either. We're not providing licensed nursing care to our patients. And so we really focus on the non-medical or that non-clinical side.
But you are not a home health care company, correct? And you do not do hospice?
That's correct.
So can you just briefly tell our listeners and our viewers the difference between home health care and home care? Is that the two categories, correct? Home care, which is what you are, correct? And home health.
Yeah, home health is a Medicare-defined benefit that provides licensed registered nurses or licensed physical therapists, occupational therapists, speech therapists, social workers. That is a prescription written by a physician in order to be received in the home. And so a therapist would come out 2 times a week to provide in-home physical therapy or occupational therapy or social worker visits. And usually they're a defined period or episode of time, might be, 4 visits or 6 visits over the next couple of weeks. But again, Medicare approved, Medicare paid for, physician driven. Non-medical home care, or what we'll call home care, is not required to be physician approved or driven, not covered by Medicare, but also does not go into any kind of nursing or therapy service. So our caregivers really stay within that non-clinical scope of their work. Things like the activities of daily living, bathing, dressing, toileting, ambulating, and the IADLs, instrumental activities of daily living. It's grocery shopping, cooking, cleaning, transportation, those kinds of activities.
And tell us, we have a few minutes left. What are your company's goals for your future, for the coming years? Is it technology? Is it growing size wise? Is there something you think that you could do or you hope to be able to do in the future that will provide better service or help you grow your company?
Yeah, I think the couple of things that I would love to see happen is a broadening of the conversation around payment for healthcare or home care. I think we've started in a good place with Medicare starting to recognize the importance and need for these services. I think there's one of the goals is for our company to stay involved with a lot of the development of some of these benefits. I've personally been involved with several Medicare Advantage plans as they've explored home care and talked about how to incorporate their benefits into their offerings to their constituents. I think it's really important, though, that we continue those conversations on how to keep home care affordable, how to keep patients in their own homes. And I think that's a really critical moment, because if not, patients are going to be getting sicker at home for longer. They're going to exhaust their financial resources faster, and they're going to become, the burden of the state to pay for in a long-term nursing home, which is going to cost way more than it could if we keep these patients safe at home. So I think the ability to diagnose and treat patients earlier and to prescribe them, or at least help identify home care as a viable option earlier, is very important, because we see that need continuing to grow over the next 30 years. The last of the baby boomer generation, I think, turns 65 by the age of 2030. And our average patient is probably 85 years old. And so if you look at that, it's not going to be until about 2050 that tail end of those baby boomers are turning 85 and needing care. And by then, they're probably going to be living well into their 90s or late 90s. So I think the conversation about how do we get care and keep it affordable, how do we find more care providers? That's another big topic we're interested in, is helping more people become professional caregivers. Right. Those who have led wonderful careers, but they just want to help and serve. And we have a wonderful program to help connect our older workforce with patients who need companionship.
Unfortunately, our time is almost up. We have less than a minute. First of all, I want people to know how they can find you. And we want to thank you, all of us who are listening and viewing and who have been or are currently caregivers. We want to thank you for what you provide to our parents and our families, and tell people how they can find you. Yeah,
you can call our office here at area code 949-916-6705. That's our main office here in Orange County. Or you can reach us on the web at www.caretostayhome.com. That's all spelled out, all one word. And we're so grateful to be here and so thankful for this conversation. It's a wonderful, wonderful conversation.
Thank you. And we'll be doing it again. We'll be doing it somewhere. There's lots of other things we could talk about. Thank you so much for being our guest today,
I love it.
Parker. Thank you. Bye-bye.
Thank you.